My name's Haywood Hall. I'm a U.S. trained emergency physician. My career has taken me all kinds of incredible places, but I actually was raised in Mexico, and I didn't learn English till I was 8. And I had a career driving taxis and reading electric meters and other things, and got a GED, eventually went to medical school. When I finished my career, after working for a while, I felt this very strong need and draw back to Mexico to figure out what I could do. I witnessed a car accident in Mexico and was alarmed by how poorly trained everybody was. And from that point forward, I decided that I was going to basically develop a training center and see what I could do to save lives. Here's the current situation in the world, and also corresponds to Mexico. There's a lot of neonatal deaths. There's a lot of maternal deaths, and there's a lot of children dying, even of diarrheal illnesses. These are things we know how to treat. You don't even need a doctor to do some of these things. We have to figure out a way of getting the health care out to the communities before small problems become disasters. In Mexico, we have about 260,000 doctors. 85% have not done residency programs, and about 65% are licensed. And half of the doctors are in 6 states. There's 32 states in Mexico. So these folks are not going to come back to medical centers to get additional training. And so there's a real gap, a real knowledge gap. So in order to make an impact, what really needs to happen is we have to develop higher levels of competency and make sure that there's early local responses. And that's what we believe is going to improve outcomes. So we need to train people in communities at high levels. We have had a significant social impact. We have 14 employees and 150 instructors. We've trained 30,000 healthcare providers, 10,000 in emergency obstetrics, 17 in cardiac and trauma. We've had millions of people benefited from this. So we have a business model where so far all that we've done has been from the center, from our training center, but now we want to diversify into training hubs, and we think that this will allow us to scale up considerably. This decentralized model, especially when we enter at institutional levels, should result in a very fast rise. We have been working for the last few years. We've actually generated a couple $1 million in revenue. This year, there's been a little bit of a slump, but there's also been a 21% peso devaluation. And there's also been elections and other things that have frozen funds for a short period of time. But we're in very good shape. We're running in the black. We've never gotten any grants or investors. We have all of the equipment that we need for quite some time. I think that we're in a very good position to scale, especially now that we're looking at decentralizing. Our business performance is directly coupled to our impact, because we'll be training people directly with these courses, and the link is pretty much almost 1-for-1. So I think it's a very positive model. Our strategic initiatives revolve around, as I mentioned, these PACE hubs that allow us to distribute our brand and our methods through other parts of the country. Our PACE Core, which is our instructor academy, and then also our online training platform and virtual grand rounds. These are innovations that are really important because we're trying to develop a method to train people remotely and to train them in high quality. We have a very good leadership team. Our CEO was the former Secretary of Health of the state of Guanajuato and also executive for the National Secretary of Health, so we know the landscape very well. We have some clinical leaders who are outstanding specialists, and they are really committed to bringing the knowledge, skills, and abilities out to communities. Oops. Sorry. Our funding needs, we calculate around $400,000. We're trying to find grants. The factoring is really bridge loans based on contracts that we have in hand to make sure that we maintain equity, cash flow for operations, and also quasi-equity. We want to focus on strengthening our organization, the communications, finance, product, and business managers. We need to rechannel our PACE hubs so that they're focusing more on institutions. And then, of course, the online platform is going to be increasingly important over time. In the future, we plan to use this very same platform for other products, such as trauma or palliative end-of-life care, community health workers, and various other types of training that can be done on this platform. We've been working very hard with various partners. I think that we have a very good model. I think it's something that's going to have a very high impact, and we're looking for whatever help we can find. We like partners that can help us grow our concept and our program and our impact. So I hope that you can join us. As an emergency physician, I've seen 70,000 people in emergency departments. I've always been interested in what is it that has brought them to us, and I've been looking further upstream, and I'm finding myself in communities and finding what it is that actually can make a difference, and I hope that we can work together on this. Thank you very much.